Hi Annie, I'm Dr. Uterus and I will be your nurse practitioner today. This is Elena. She's a student at the local college. Is it okay if she sits in on this appointment?
Yeah, that's fine.
Okay, so I see in your chart that you've been taking Yasmin. Are you having issues with that or?
Yeah, I'm having a lot of breakthrough bleeding and I'm having trouble remembering to take it. I even have an alarm set on my phone to take it and still it's either not with me or I just have issues with it.
Oh yeah, that's the problem. Well, what were you thinking about?
Well, I was looking at your bulletin board that you have in here, and some of those look pretty appealing to me. Some of those temporary contraceptives, they look like they might be a better option than the pill.
Okay, so you're wanting something more long term that's going to be more spaced out, not something you have to take every day.
Yeah, that sounds better.
Okay. Well, let's start about talking about the Nuva ring. Have you heard about that?
No, what's that?
Well, it's a jelly-like vaginal ring. It's basically about the size of a ponytail holder, and it just goes in your vagina up to the cervix.
Okay, well how long can I leave that in for?
You can leave it in for 3 weeks.
Okay. Are there any uncomfortable side effects that I should be looking out for?
The main side effects are basically like any other contraceptive. It's going to be maybe some vaginal irritation or bleeding, and nausea, headache, some weight gain.
Okay, so just the usual kind of like the one that I'm on
Just
right
the
now.
usual, and the weight gain's not huge, so it's like 1 to 3 pounds.
Okay. Well, that sounds like an option that I might want to consider.
That's a pretty good one. And Elena, you guys have been learning in school about contraceptives, correct? Would you like to do some patient teaching?
Yeah.
Okay, would you like to teach Annie about the patch?
Okay. Well, the patch is just like, it's also known as the Ortho Ever. And it's an adhesive patch. It's about 1 3/4 inches in size. It's beige in color, so it's, you know, it fits good with the skin.
Well, do I take it off every day? How often do I have to leave it on for?
See, that's the plus with your situation. You only put it on once a week for 3
okay.
weeks consecutively, and then you leave it off for the 4th week, and that's when we expect you to have your period.
Okay. Well, being that it's summertime, you know, I like to go swimming a lot and be outside, and even just when I shower, do I have to take it off or can I leave it on?
No, it's okay to participate in swimming or bathing or anything like that with it on. Just be careful that when you put it on that you don't like trim it or cut it or damage it.
Okay. Well, how do I put it on? Are there any special places that I have to put it on my body?
Yeah, there's 4 places that you can put it on. It's the back, the upper arms, the bottom, and
I think that might have been 4, Elena. Okay.
And just be careful not to put it on your breast.
Okay. Okay, so are there any painful, uncomfortable side effects that I should look out for with this one?
No, just the usual ones like nausea, vomiting, maybe some weight gain, headaches.
Okay. Is it really expensive? How much does it cost?
We're looking at about $15 to $50 a month.
Okay, well that's not too bad.
That's one of your more affordable options.
That one sounds pretty good too. Might be what I consider.
Okay, and the next one we'll talk about is more of a long-term option. Have you heard about the implant?
What's that?
Yeah, well, it's called an implant, and it's about, actually, this size. It's about the size of a matchstick. So it's pretty small. And
Where does that go?
Well, it actually goes in your arm. Right here.
Does it hurt?
You mean to get it implanted or all the time?
To get it implanted. Either,
Well,
really.
Either. Of course. Well, what you do is you come see me, and I would just give you an injection to numb the site, and then we would just slide it in there. The most pain that you're going to have is more than likely from the numbing, and a little pinch.
Okay.
But it only takes a few minutes. It doesn't take long at all. And then after that, it should not hurt. You should not see it or anything like that.
Well, how long can I have it in there for? Do I have to get it taken out after a certain amount of time?
Yeah, there's actually 2 options. It's a 3-year and a 5-year. And we normally recommend that you get the 3-year one because a lot of people say, oh, I don't want children, but then they'll decide that maybe they do. And since the implant is kind of pricey, we do recommend the 3-year. That way, if you do change your mind, then you don't have as long to wait, but you can have it taken out anytime that you'd like.
Okay, so I would just have to pay for it to get it put back in?
You'd have to pay for it to get put back in, yeah.
Okay. Is there anything that's like abnormal that I should look out for that I would need to contact you?
Well, with the implant obviously, you know, it's in your arm, it's an implant, so what you'd want to look out for is redness at the site, any type of infection, so pus or swelling. If you would form a lump over your breast, you would need to call. And also with the implant it can actually have you cause you to stop your period to where you don't have any. But if you would continue to have your normal menstrual cycle and then all of a sudden maybe 6 months, 7 months later you stop for whatever reason, then you need to contact me.
Okay. When does it start to work? How often, you know, how long after I get it put in am I protected?
Well, you're supposed to have it put in within the first 7 days of your menstrual cycle, and then as soon as it gets put in, it starts working within the next 24 hours. Okay.
Well, you guys have given me a lot of options so far to think about.
You think anyone sounds better than the others?
Well, I haven't, what's the shot? I haven't heard about that one.
Elena, do you want to talk about the shot?
Yeah. It's just a shot that releases the progestin, but in a slower manner.
Okay. Well, how often do I have to get it for?
You get it. It's effective for 3 months, so you get it every 3 months, and it's important that you get it within 5 days of your menstrual cycle. So if you come in and it's been after 5 days, we recommend that you do something else.
Okay. Are there any uncomfortable side effects that go along with this method?
Just your common ones: nausea, fever, slight maybe decrease or even increase in weight.
Okay. Well, after hearing about all of these, I think that the NuvaRing sounds the best. A lot of the other ones you said cause you to stop your menstrual cycle, and I just feel like that's a natural thing, and your body's supposed to go through that. So I'm thinking the NuvaRing sounds like the best option, but I'm still a little fuzzy on how you get it in there, so could you maybe explain that to me?
Of course, yes. Okay, well, like I said,
you have a little picture on there, so maybe you could just show me.
We have a picture. Like I said, it looks like a rubber band, so you want to squeeze it together. I make sure you wash your hands first before doing this. And you actually have 3 positions that you can do. You can either lay on your back with your knees spread apart, or maybe you can sit on the toilet or on a stool. And another option would be propping your leg up on a toilet or a stool. One leg up, because it needs a more broad opening to be able to get it in there. And then you just push it up in until you can't get it to go anymore, because it's not going to go farther than it should.
So I'm not going to lose it in there.
You're not going to lose it in there. It won't go beyond the cervix, and that's where you want it to be.
Okay. So kind of just like putting a tampon in. It kind of
basically
relates to that.
Just like putting a tampon in. So.
Okay. Well, how often after I get it in am I protected? How long do I have to wait?
You mean as soon as you put it in?
Yeah.
You're good as soon as you put it in.
Okay. All right. Well, what if it falls out? Do I have to like get a new one, or? Well,
that depends on, say it falls out and you see it's falling out right then, you would just need to wash it off with cool or lukewarm water and then put it right in immediately. But if it's fallen out and you don't know how long it's been out, like, because the standard is if it's been out longer than 3 hours, then you're going to have to do like an emergency contraceptive for the next 7 days. So you'll have to use some condoms or something for the next 7 days. Okay. Backup plan.
So just get it in there as soon as possible after I realize it's out.
Yeah.
Okay.
Yeah, but if you don't know how long it's been out, then I would suggest maybe using condoms or some other type of backup, a diaphragm or something.
Okay. Well, hopefully the NuvaRing works out for me. It seems like it's going to. It seems like the best option for me.
It's a really good option, and a lot of women really like that because you can't feel it.
Yeah. Well, thank you guys for all this informative information.
Oh, you're welcome. Actually, let me see your survey real quick. Thanks. Okay, so I see that you're not a smoker and you're not pregnant. Is that correct?
Yes, that's correct.
Okay, well, that's 2 important things. I want to make sure before you start you on any kind of contraceptive that.
Why is it that when you're a smoker that you shouldn't take contraceptives? Does that have something to do with like clotting?
Yeah, it can actually increase your risk of blood clotting. So, and especially if you're over 35, which obviously you're not, but it does increase the risk of blood clotting. So it's always nice to know. And if you're pregnant, we obviously don't want you taking birth control. So.
Of course.
Yeah.
Does this protect me from any kind of STDs or anything?
No, ma'am, it doesn't. It does not. You have to use a condom for that. And other than that, this obviously just protects you from getting pregnant.
Okay. All right.
So did you have any other questions for me?
I don't think so. Do I just, about how much does this cost? Roundabout.
Well, this one is, let me check in my papers, I think, these can take some time, around $250, but your insurance should pay for that.
Okay, that's what I figured.
Okay.
Okay.
So I'll go ahead and put the prescription in, and it should be ready for you to pick up.
Okay. And if I have any questions, all I have to do is
just call you. If you have any questions, just call me.
Okay.
Okay?
All right. Thanks, guys.
Thank you. Annie. So I see that you're here for a follow-up because you had some questions about your birth control that we just started you on.
Yep, that's right.
Okay, and Elena's with us today. What did you have a question about?
So I was wondering if there was any kind of special diet that I need to follow, like while I'm on this birth control. Anything specific that I should be eating or not eating?
No, there's no special diet. Just remember to include vegetables, variety of fruits, vegetables in your diet. And also remember about the alcohol. Limit the intake just because it's known to increase your blood pressure. And so are contraceptives. And we want to keep that within normal limits. So limit your alcohol intake and include vegetables and fruits. That's about it.
Okay, I'll do my best to follow that diet regimen.
You said you're not a smoker, right?
No, not a smoker. Okay, so, and I also didn't ask during the last appointment, but does this like fall out at any time? Are there any kind of exercises that I can't participate in?
No.
Or is it going to stay?
No, it should stay in. There's nothing that you can't participate in. Actually, exercise is really good because with contraceptives, you can get higher blood pressure. And so that would help you. Plus, it also helps your stress level. So it will reduce your stress level and reduce your blood pressure. So that's really good. Any type of swimming, running, anything like that's good.
Okay. And then also, I mean, this doesn't protect me from STDs or anything like that, so I still need to be practicing safe sex.
Yes. Yes, you do.
Okay, so how often am I supposed to come in for a PAP, being that I'm sexually active?
The PAP is every 2 years.
Okay, and how does this birth control work again? I really don't understand how this little ring is protecting me from getting pregnant.
Well, there's two main hormones. It's estrogen and progesterone. And what they do is they prevent the egg from basically forming. So it prevents ovulation. So when you don't ovulate, there's nothing for the sperm to attach onto.
Okay, well, I think I understand everything a little bit better now, so
Okay.
thank you guys for clearing that up for me.
All right, then we'll see you in 2 years unless you have any other questions.
Okay, thank you.
Okay, thanks.
Thanks.